Hi, welcome back. I'm Adam Rosen, an orthopedic surgeon who specializes in joint replacement. If you haven't already subscribed to the channel, subscribe below. That helps you be aware of some of these new videos that are coming out. And if you like this information, click the thumbs up button. It lets people like you that are looking for information like this find it. So if you've looked at a lot of my other videos, many of my videos are geared towards knee replacement. So people that are considering knee replacement or in preparation for their upcoming knee replacement, or how to get a good recovery after knee replacement. But a lot of people I see in the office don't need a knee replacement, or they're just not ready yet. And they still have knee pain, they still have arthritis. So these are my top 4 things that I recommend to everybody when they're going on a trip or traveling if they suffer from knee pain due to arthritis. And this also holds true that if you have foot pain and arthritis, ankle pain, hip pain, back pain, these things will help you as well. So number one thing, what I tell everybody is go to the drugstore or go to your local outfitter. This is one from REI, and get a collapsible cane or hiking pole. Some people don't like the idea of a cane. There's a little vanity involved there. But having a hiking pole, you're having a hiking pole, not using a cane. But keep it in your luggage. You may not need it. But if while you're there, you're doing a lot of walking, something happens and your knee's sore, you can pull this out of your luggage, extend it to the height that you need, and use it on your trip. So number 1, get a collapsible hiking pole. Number 2, get a Ziploc freezer bag. And if you put this in your luggage, a lot of times now we have these in our luggage all the time, but you might need ice. And a lot of times if you're on a cruise ship or you're at a hotel, you might find an ice machine. But then where do you put the ice? You try to wrap it in a towel, everything gets soaking wet. So if your knee's sore, you have this Ziploc freezer bag, and you can use it for the ice if you need to ice your knee. Inside the Ziploc freezer bag, when you're packing your luggage, put in a bottle of your anti-inflammatory of choice, and put in a bottle of acetaminophen or Tylenol. And this way, these are in your luggage. If you have a headache, you have something to take. If you have knee pain, and again, I've talked about this in my other video on these over-the-counter medications, you can use acetaminophen, which is Tylenol. It does not cause bleeding, it helps pain. You can use one of the anti-inflammatories such as ibuprofen, which is brand name Motrin or Advil, or naproxen, which is Aleve. Just know that they can cause bleeding, and if you're on blood thinners, have heart disease, kidney disease, avoid those. But if you don't have a reason that it's contraindicated for you, then you can use that as both a pain reliever and an anti-inflammatory. And by using one of those anti-inflammatories or the acetaminophen, or we talk about the combination therapy, so adding one of one class, so one acetaminophen with one type of an anti-inflammatory together, that may help the pain. So if you're doing excursions or you're traveling with your family or your spouse and your knee's hurting, you have something that you can take. You don't have to run around to the drugstore, or pay 5 times the normal rate in the drugstore and the hotel because you needed one of those pills. So top 4 things. Number 1, collapsible hiking pole. Number 2, Ziploc freezer bag. And number 3 and 4 are your pills of choice, acetaminophen or Tylenol, or an anti-inflammatory such as Motrin, Advil, or Aleve. So thanks again for listening. I hope this helps you in preparation for one of your next upcoming trips. And until next time, stay safe.